Hi guys, welcome to another eVlog, eDentistry's educational videos. Today, I'm going to talk to you guys about post-operative instructions after dental extractions. Now, if you've just had a tooth taken out, how you look after yourself immediately afterwards is really important, as it's going to influence how well that area heals. I'm going to break this information into three main phases. The first phase is what I like to call the blood clot formation phase. Now, when the tooth's been taken out, your dentist will have put a little piece of gauze and asked you to bite down on it. Now, it's really important that you stay biting on this piece of gauze for half an hour. What the gauze does is that it creates a little piece, a covering on top of the extraction socket so that the socket can slowly fill up with blood, and when it sits in there for long enough, it will create a clot. If you don't stay biting on that piece of gauze for half an hour, not only is the blood clot not going to form properly, but additionally, the blood clot may stick itself to the piece of gauze, and when you take the gauze out, it's also going to take the blood clot out too. Without a blood clot, it's not going to heal very well, and unfortunately, it's usually quite painful as well. Now, the second phase is what I call the blood clot stabilization phase. For the first 24 hours, the blood clot is particularly fragile. It's very easy for it to break because it's in a jelly-like state. Now, the three main causes for a blood clot to break down is 1, physical trauma. So that includes, say, for example, eating really hard foods like nuts and corn chips. That includes playing around with it with your finger or your tongue. And that includes even brushing your teeth. This is one of the few situations where a dentist is going to tell you not to brush your teeth, because a toothbrush can create a lot of physical trauma in that area and break the blood clot, particularly in the first 24 hours. The second category of things that can potentially cause damage to the blood clot is rinsing or washing the area. If you use any water or any mouthwashes to rinse that area in the first 24 hours, the blood clot is not strong enough to withstand that. And unfortunately, most of the times it will get washed out. So don't rinse or wash that area for the first 24 hours. The third category of things that can potentially cause damage to the blood clot is suction or negative pressure. This can be created, for example, if you're sucking something through a straw, or for some reason there are a lot of people who tend to want to suck on the socket immediately after the tooth's been taken out because it feels unusual. The final thing that can create a lot of negative pressure is smoking. When you're sucking on the cigarette, that also poses a risk of pulling out the blood clot from the socket. So please try and avoid these three categories of things that might cause the blood clot to fall out. The final phase is what I like to call the healing phase. The blood clot has already formed and it's already stable. But we want to try and keep the food and bacteria out of it. So this is from 24 hours onwards. The best way to keep food out of the area is immediately after eating anything, simply take some warm salt water or some mouthwash and rinse that area fairly vigorously for about 30 seconds or so. And that will loosen any food scraps or particles that have built up in that socket. Now, if you're going to use salt water, make sure you don't have it too concentrated, because if you have too much salt in there, it's going to make the wound sting quite badly. Also, don't use any water directly from a tap, because that actually has too low salt concentration. And unfortunately, putting fresh water into an open wound will also cause discomfort. The best thing to do is just get a small glass of warm water and put 1 pinch of salt in there. That's usually enough to create a fluid that's about the same concentration as your own bodily fluids, and therefore won't create that stinging sensation when you flush that area out. Well, that's it for this episode. We'll catch you again next time. See ya.